Hi, this is Dr. Dean Kelaita with a COVID-19 update for today, August 10th, 2020. COVID-19 infections in Calaveras County continue to rise. Several new developments have occurred locally that, if continued, may lead to further medical care impaction or potential overwhelming of our medical system and of potential mortality or further deaths. Nationally, throughout the United States, the U.S. continues to experience the worst coronavirus outbreak in the world. The United States accounts for less than 5% of the world's population, yet represents more than 25% of all of the COVID-19 deaths or cases seen in the world, and 22% of global coronavirus deaths. California, on the other hand, getting closer to home, has reported 561,911 total COVID-19 cases with over 10,000 deaths, 10,359 to be precise. Approximately 9 million tests have been performed statewide. Calaveras County Public Health has confirmed 147 total coronavirus cases among Calaveras County residents, with one reported death. The death toll, fortunately, has not been high for us locally. There are currently 2 hospitalized patients residing in our community, and the ICU intensive care unit capacity is 65%, with 100% ventilator availability, which is not bad. Calaveras has not been placed on the county monitoring list that's maintained by the state. That's the process by which the state grades counties on how well we're performing with coronavirus containment. On July 25th, the state experienced a failure of the main server in the primary computerized database known as CalReady. CalReady is the electronic disease surveillance and reporting system that's overseen by the California Department of Public Health. So what this system does is it's responsible for tracking and reporting COVID-19 test results back to local health departments so that the local health departments can begin the process of contact tracing for those cases. So for 5 days between July 31st and August 4th, one of the biggest commercial laboratories in California that's called Quest Diagnostics was unable to report lab data into that state CalReady database system. And this resulted in an extensive backlog of between 250 and 300,000 tests that the results got delayed getting to counties. Quest is the commercial lab that processes the coronavirus tests done at our local OptumServe test site at the Calaveras County Fairgrounds. So it does impact us locally. It turns out that CalReady wasn't ready. The system has been fixed over the weekend, and now the tests that were delayed in getting reported, the backlog test results, are now coming into local health departments at one time now for investigation and contact tracing. So the risks to the health of Calaveras County residents is not quite clear at this time. That has yet to be fully determined. Our public health department epidemiology staff is currently in the process of going through those test results that have all come in a big data dump yesterday to better understand the impacts of our residents. We have a press release that's coming out later today, and that'll be where those results can finally be announced to the community. So we were initially encouraged that our local case rates were plateauing during this brief 5-day interval, but I predict now a larger number of new local cases is going to be reported by the end of the day. So that was a little bit of false hope that things were quieting down a little bit. And again, these updated figures will be released in our Tuesday afternoon press release from the Public Health Department to the community. On July 31st, an elderly female resident of Avalon Nursing Home in San Andreas was identified as a positive case of COVID-19. This is important because an outbreak in a nursing home can be very dangerous. So this positive case was identified through testing of all the residents that was performed once an asymptomatic staff member who was working in the facility was identified as being a positive case of coronavirus as part of routine testing of the staff members that work in the facility. Also now one additional case of infection was identified in a Avalon resident on August 7th after the ill person was sent to the hospital and admitted to the intensive care unit, and testing subsequently confirmed the presence of the coronavirus. So far, no additional cases besides those two have been detected in any other residents or staff of the nursing home. The nursing home has increased its infection prevention efforts to the maximum capacity, but obviously close surveillance of the care home will continue, and it is a source of high-risk individuals, and outbreak in the nursing home needs to be avoided at all cost. Due to the delays made worse by the delays in getting the disease reports timely from the California CalReady system, the state has suspended putting counties on or taking counties off of the state county monitoring list at this time. So as I touched on previously, Calaveras County is not on the monitoring list at this time. And we'll have to see what the data looks like in the next week to 2 weeks once we can process the information that all came in yesterday, and see, I think at that point, how well positioned we are in terms of our local rates of disease, our testing numbers, our hospital and ICU capacity. So I meet weekly with Mark Twain Medical Center representatives, and we assess the hospital, the intensive care unit, ventilator availability, and personal protective equipment, PPE needs for the medical care system and the healthcare providers. Mark Twain Medical Center is doing an excellent job in caring for our community, including coronavirus patients as they need. Amador County is seeing a significant surge in cases in the past 2 weeks, which has been primarily driven by an outbreak of coronavirus cases at Kit Carson's skilled nursing facility in Jackson. Now, because Calaveras County residents cross into neighboring counties such as Amador County, San Joaquin County, Stanislaus County, Sacramento County, it's not unusual for people to go to those jurisdictions for work or for many essential activities. Because of the increased rates of disease in our neighbors, it's very important for our residents to take precautions when traveling to those nearby areas to prevent getting infected and bringing the virus back home. So that's something that we need to be conscious of as we go through our regular activities and visiting those neighboring communities. So my goal as health officer, as I've said before, is to keep our residents safe during this pandemic and to avoid falling onto the state county monitoring list. So the ways to do that are not complicated, and they're basic science. So the best ways to avoid exposure to the virus are stay at least 6 feet apart, 6 feet away from people, from others, when outside of your household. That's called physical distancing, social distancing. It's a very important criteria to avoid transmitting infection. Washing hands with soap and water for at least 20 seconds. Avoid touching the eyes, nose, or mouth with unwashed hands. And wearing a face covering. Now, face coverings are routine cloth bandanas, cloth masks that can be purchased. And when covering the nose and mouth when around others, they provide an additional level of protection. So wearing a face covering is an important tool in the fight to keep coronavirus in check. Preventing further infections is not only a way that keeps us healthier and reduces the risk of overwhelming our medical care system, which is not very robust to start with and wouldn't take much to get overwhelmed. It's critical in preventing us from suffering further business closures and getting added to the state monitoring list. And this will allow us to keep businesses open that are open right now and more quickly reopen businesses and get our kids back to school safely when that time comes. So thank you for your cooperation. Further information will be released to the public later today on Tuesday in the form of our press release, as well as it comes in and can be shared with the public as quickly as possible. So thank you for your efforts, thank you for your interest, and thank you for doing your part to keep our community safe, our businesses open, and getting our kids back to school.